You can find information about diabetes almost anywhere, from books to TV to magazines to the internet. Many of these things can be misleading when it comes to talking about diabetes and the cure for diabetes and other things that are not really based on facts. Today, I have Dr. Greenblatt here from Duke Medicine, and he's going to bust some of the diabetes myths for us and explain some of the facts for us so we're a little more clear on what's true and what's not. Thank you so much for joining us today, Dr. Greenblatt.
It's a pleasure to be here.
Dr. Greenblatt, what is your specialty at Duke Medicine?
I practice internal medicine, which is an area that focuses on the care of adults, particularly those with complex or chronic diseases.
Can you describe for us today what type of care you provide?
So currently my role is entirely in the outpatient setting. I work in a clinic, and I have patients who range in age from 18 to about 95, and I provide comprehensive primary care to this group.
Okay. One of the things that I have heard is that only overweight people or people who are obese can get type 2 diabetes. How much of that is true and not true?
Well, actually, people who are overweight are at higher risk for getting diabetes, but it turns out about 15% of all people with diabetes have a normal weight.
Wow.
So people with, who are heavy are at higher risk, but anybody can get diabetes.
Another myth is that a person can catch diabetes from another person. Can you tell us the real story behind that?
Well, certainly you can't catch diabetes. It's not contagious. It's not an infection. But I would say that diabetes is more common in certain groups. So Latinos or African Americans, they have higher rates of developing diabetes. It's also true for Asians. So they don't catch it from each other, but you might see certain populations where there's a lot more diabetes. Also, people tend to adopt behaviors of those folks who are in their peer group. So that if you're with people who enjoy eating, don't do a lot of exercise, tend to be heavy, it's clear that you as an individual might then gain weight as well, putting you at higher risk for getting diabetes.
Thank you, Dr. Greenblatt, for joining us today on Living Healthy Durham County and separating some myths from facts. You shared some really great information and helpful information.
It was my pleasure.